Hi, everyone. My name's Cody, and I'm the organizing director for March for Science Action. And welcome back to Black in S.T.E.M. This is a regular series where we talk to Black professionals in various fields and get a perspective of not only where they came from, but also where they're going and how others can follow along their path. Last week, we talked to Vince Collis. He was a tech owner and political consultant for quite a few different campaigns. And you should check that last episode out. It's on our YouTube page as well as our Facebook page. But this week, I think that there's been a lot of news about the pandemic and about public health in general. And so this week I wanted to bring it back and talk to a medical professional. And I am so lucky to have this week Dr. Bertha Serwa on the show. And Dr. Ayi is a board certified infectious disease specialist and adjunct assistant professor of medicine at the Kansas Health Science Center. And on top of that, Dr. Ayi is also the vice president of the Ghana Physicians and Surgeons Foundation of North America. And as if that wasn't enough, she also has an MBA from the University of South Dakota, is an author of 2 books, and has appeared multiple times in various medical journals. But before I hype her up any more, I just want to welcome her onto the show. So Dr. Serwa, welcome on.
Thank you for having me, Cody.
Absolutely. So I want to be respectful of your time, and we only have 30 minutes to kind of go through a lot of your journey. And before we get started, we'll be talking a lot about the country of Ghana. And so I could actually show y'all a map of where Ghana is. It's on the continent of Africa. And this will be just relevant to our story later. But thanks so much. And also thank you to Britannica for showing us that photo. Dr. Serwa, could you just tell us a little bit about how your journey started and how you got into medicine?
Thank you very much. So I grew up in Ghana. I was born in Ghana. I was the last of 6 children. I grew up playing in the streets of a little suburb of Accra, Ghana called Latebiokoshi. And my father was a bus driver, actually, and my mother was a trader. And so I had no business ending up in the medical field. When I went to medical school, my colleagues were the sons and daughters of professors and doctors, etc. So I think that God just made a way for me. When I went to primary school, I realized I was very smart. I was either the first or second in class. Those times, it wasn't just a grade. At the end of the year, you had an ordinal system for determining who did well. And so I realized I was doing well in school.
Mm-hmm.
I went to high school, and then in my 3rd year of high school, which would be equivalent to the 9th grade here, I
Mm-hmm.
became very ill with something called cerebellar ataxia. I couldn't walk or talk, and I was in the hospital for about 3 months.
Oh,
And
wow.
so I really thought my life was over and that I was going to be in a wheelchair, but I miraculously recovered. And
Mm.
so that plus bouts of malaria several times a year gave me a certain degree of determination, which when I look back, I'm thinking for a 12 or 13-year-old, I was super, super determined to become a physician with the goal that one day I will eradicate malaria and also make an impact in the healthcare industry, hopefully by building an infectious disease research hospital that would one day eradicate malaria. And so I finished high school. I had really good grades and I got admitted into the medical school with no hassle. And
Yeah.
after that, I came to the United States to study internal medicine, and I
Mm.
subspecialized in infectious diseases, mostly driven by my desire to do something about malaria.
Yeah. What was that 3 months in the hospital like for you? That must have been really scary, especially being that young. I feel like now that, well, I don't know. I'm an EMT as well, and I feel like there's a certain comfort that comes along with knowing what's happening, but then also a certain amount of chaos of being like, I know what's happening to my body. It's kind of freaking me out. But at 13, you don't have that. It's just kind of this subjective thing. What was it like being in the hospital and like interacting with the doctors there while you were kind of going through it?
I think it gave me a first-hand perspective of what it meant like to be in a hospital bed
Mm-hmm.
and with physicians coming in because I got to treasure every moment I spent with a doctor or a nurse. and for those who stop by. So I feel it's made me a better physician for one thing because I know how to interact with patients.
Yeah.
Secondly, it allowed me to feel the love of my family and how they were extremely concerned about me.
Mm,
Um, and I had a sister who would bring me Jeffrey Archer books. I
mm,
read a lot of like 3 to 4 inch books. I read Roots. I read many, many books during that 3 month period. I mean, even though I was ill, I
mhm,
was able to engage. I mean, it was my motto and my coordination that was off, but I could read very well, and I used that opportunity to read a lot.
mhm,
It also brought me closer to God. And finally, I think it gave me a sense of I was starting life over and that if I
mm.
recovered, this was another opportunity. So I went back to school a very, very different person than I was before I got ill.
Yeah. It
So
sounds like you were already determined before you got sick,
I
and
was,
then that
I
was just like another slingshot.
I was a little determined, but I think that illness did something to me because whenever I looked at myself, all I saw was somebody in a wheelchair, for the rest of her life. So for me to have recovered and went back to school, um, it was a very wonderful opportunity to be
Yeah.
able to recover.
And is malaria, the second part that you were struggling with the bouts of malaria, is that still common in Ghana today, or is what I guess what progress has been made since that time that you were struggling with it, or has there been any progress?
So malaria is still very common.
Mm,
It affects about 1 million children. So let me put it in context. So far,
mm,
COVID has killed about 2.6 million people.
mm.
So malaria kills 1 million children every year.
Oh wow, I didn't
One,
know that.
yeah, 1 million children under the age of 5 will die from malaria every year somewhere in sub-Saharan Africa. So much as we're all concerned about COVID,
Mm,
um, on the grand scale of things, malaria is a much, much bigger problem. Over 640 million people every year get infected with malaria. A lot of them recover,
mm,
but it's those who are below the age of 5 who are more likely to die. So the
mm,
thought is that if you are able to survive malaria up to 5, you probably won't die from it, but
mm.
when you fall ill, you would have fever, bodily aches, extreme joint pains,
Yep.
vomiting. It's not a pleasant illness. And I used to get it quite a lot. And every time I got it, I'm like, if there's one thing I can do with my life, it's to make
Mm,
sure that somebody else does not have this. So,
yeah.
what progress has been made? Malaria is still being treated with different anti-malarial agents,
Mm,
artesunate, coartem. Um, in most areas, it's now resistant to chloroquine, which I used to take.
mm,
But there's been some progress towards a vaccine. Now, the parasite itself is made up of about 5,400 proteins. And I
mm.
know I'm bringing this up because now we have a COVID vaccine, and people are wondering how did we get this vaccine so quickly? So
Yeah.
you realize that with COVID, most of the vaccine developers have tried to target the spike protein.
Mm,
With malaria, there are about 5,400 proteins, and so far the vaccine manufacturers have targeted only about 4 of them. And it could go wrong. There's only one malaria vaccine that is being tried in some African countries right now. I
mm,
believe it's called RTS or RSS, one
mm,
of them, but it's being tried. And a lot of them don't do very well. And I can see why, because you have a parasite which is made of 5,400 proteins and you're targeting only three.
mm,
So when I look at it from where I'm sitting as an African who has always wanted to get rid of this,
mm,
uh, versus, people who are just looking at Africans and say, oh, let's go help them, let's get a vaccine for them.
mm,
I feel that the best way, if as I think about how I want to go about it, is to really mobilize young people to understand the problem,
mm,
uh, what the malaria does, what the plasmodium parasite does,
mm,
and to try and get rid of the parasites. Because that's what, I don't know if you know this, but several years ago, malaria was endemic in Baltimore and it was endemic in Florida. And
mm.
over a 2-year period, The Centers for Disease Control set up a spraying program with
Hmm.
DDT, and within a matter of 2 years, malaria was gone from the United States for good. And it wasn't because there was a vaccine; it was because there was determination to get rid of the mosquito vector, which you get it by when a mosquito bites you and injects the malaria parasite. So um, as I sit here, I'm thinking that is the way to go. If we can mobilize young people to understand the disease, the sealed gutters and places that harbor the mosquito vector and its larvae, we should be able to do it. And maybe if I ever get in a position where I'm making decisions on whether the parasites, the mosquito we get rid of the mosquito or not, I think that will make some headway.
No, that's amazing, and especially, I guess your bouts with it encouraging that. With all these different battles that you were taking on in Ghana, what led you to the United States?
So I wanted to subspecialize. I wanted to be able to become a consultant. Uh,
Hmm.
you realize that you can be a doctor and not make any difference because you are not in a position to change anything. You don't have the power and the influence to do that.
Hmm.
So I wanted to subspecialize, get more knowledge in my area. And at the time I finished medical school, the postgraduate training was a little slow. It was hard to get into. And so coming to the United States was an opportunity for me to get more knowledge, be able to talk and sit at the table with the people who make decisions,
Hmm.
and be able to make a difference that way. And so when I finished my internal medicine, it was this same malaria desire that led me into infectious diseases. As a matter of fact, I did end up. I met with some people from the Naval Medical Research Center to look at how I could start working with malaria right away. And I went through a series of interviews. And then at the very last minute, one of them said, I think this lady would do better if she subspecializes in infectious diseases. So
Hmm.
I started that fellowship in Nebraska. So that took me away from the East Coast.
Yeah.
And after that, I started working. But I haven't taken that zeal and that desire from the back of my mind.
What was it like going from Ghana into Nebraska? I feel like that'd be a pretty drastic change to go from there, especially with I live in the Midwest as well. What was that? Was there a culture shock to it, or what was that like?
No, I had done my residency in Baltimore. And so
Mm,
I had lived in the US for a while, um,
okay.
3 years before I went into Nebraska. So it wasn't much of a culture shock.
Okay. Was it kind of a culture shock going from Ghana to Baltimore then, or what was I guess your experience coming from Ghana into the United States? Was it what you thought it would be?
It wasn't too well. You grew up watching some American movies.
Hmm.
I think the only thing I found surprising was the number of medications the average American is taking,
Oh,
um,
really?
for different things, and
Hmm.
a little bit of intolerance to pain. Like pain needs to be dealt with right away, um,
Mm,
and a little bit of the different power structure in Africa. The patients are super, super grateful for any medical care. In the US, it's a lot different. It's a sense of it's my right, it's my entitlement. I get to choose who I want to see. If a patient can decide, I don't want to see you anymore.
mm.
In where I come from, there are not enough physicians. And so,
Oh, so it creates that kind of like that scarcity where you're like, oh man, I'm happy to just see a doctor in general.
yes, yes.
Mhm.
So it wasn't too much of a culture shock.
It's interesting because I feel like a lot of the conversations that we end up having as Americans are based off of this notion of quality of care, and then also of being able to have access to high quality medical care, and a lot about the healthcare system and about how a lot of people can't afford it. I think that I'm not, don't quote me on this, but I'm pretty sure the number one reason for bankruptcy in America is still medical debt, and that's been exacerbated by the COVID crisis. But I find it really interesting to see your perspective coming from Ghana, where the access even to doctors at profession is so small. And then I guess with that perspective and coming into medical school, was it different going into, because you didn't stop with medical school, you then went on to further programs. I think you worked with Johns Hopkins and went on to different programs. What was it like interacting with other medical professionals that were from either the United States or from other countries?
Well, but don't so let me explain. I think I missed something. I finished my medical school in Ghana, and then
Yeah,
came to the US to do internal medicine and then
yeah,
infectious diseases.
yeah.
So it's not so to put it in perspective, I know I talked about the differences I saw once I came in, but at
Hmm.
the same time, I remember I came here to learn. So what am I learning? Um, Even though physicians are scarce in Ghana, there's a lot that can be done to improve the system. Like we don't have enough hospitals. Take a
Hmm.
good example with all this COVID pandemic.
Hmm.
Once the cases started going up, it was very difficult to secure a bed for a hospitalized patient with COVID. A
Hmm.
few years ago, there was a cholera outbreak. Like when there's no crises, the hospitals are fine. Whenever there's a crisis or new diseases like this pandemic, you
Hmm.
realize that we just don't have enough hospital beds. So what I
Yeah.
see is we need more hospital beds for, in Ghana and several countries in sub-Saharan Africa.
Hmm.
But besides the hospital beds, what I see is we also need systems in place to run efficiently. It's not just about putting a building in place. I'm
Hmm.
learning about teamwork. I'm learning that when there's a problem, not one person solves it. You bring a team together and you
Hmm.
find a system that works. I'm learning that when you have a hospital, it's not just about putting physicians in there. You need a system to make sure that the medical records are kept well, patients can access the system. You need something to make sure that the person who cleans the hospital is accountable to someone. The physicians are accountable to someone. The physicians are talking to each other. It has to be like a well-oiled machine. So that's what I am learning with my United States experience. I've learned the medical side, but I'm also learning how do we get systems to run efficiently even if there are few doctors? Is there a way we can use telemedicine to provide care for more people, for example? So I'm picking a lot from my United States experience.
That's amazing. And then what's that been like, I guess, communicating that expertise back home to Ghana? Or I guess just saying like, hey, here's what I've seen work. Do you feel like you have a pretty receptive audience? Do you feel like you are able to get that point across? Because I know earlier we were talking about how you wanted to not only be this medical professional, but you also wanted to help influence the environment that all these other medical professionals are also working in. So do you feel like you've been able to make that impact in Ghana yet?
Not yet. I'm working on it. So I formed an organization called the Global Infectious Disease Institute,
Hmm.
um, with the goal of raising funds to
Hmm.
be able to realize this idea of a hospital,
Hmm.
because sometimes there are barriers to going back. I have kept a medical license in Ghana active, so if I went there tomorrow, I should be able to practice medicine
Hmm.
immediately. But when there's a system in place, sometimes it's a little difficult to break in with new ideas. And
Hmm.
I
Yeah.
realize that it takes a lot of funds to be able to make a difference because you may have to go and set up your system and let it run. You cannot just show up and say, "Hey, I've come from the United States and these are my ideas and
Yeah.
these are going to work." So
Yeah.
it's going to take a bit of mindsets change, gradual letting people buying into new ideas, and
Yeah.
raising funds, a lot of funds.
Yeah. It's interesting that I when I initially went to college, I wanted to go and be a medical doctor, and I thought that a lot of the problems that were in America, as far as people getting help or people getting access to healthcare, were because, excuse me, doctors, and that wasn't the case. It's just it really is a system thing. But that's really amazing, and you still want to build this hospital. What's kind of like or I guess just backtracking even from there, what have you been hearing from like either friends or family that you still haven't gotten about how the pandemic has been for them over there? I feel like a lot of the lens that I see COVID-19 news through is from the United States. What's it been like for like people in Ghana or for people that you still know?
Okay, so Africa has recorded 100,000 deaths so far and
Mm,
counting, probably in the last month or so.
hmm
Uh, the case, at some point, Ghana had about 700 cases a day. In the last 24 to 48 hours, they're getting about 300 a day.
hmm
Um, the deaths that have been counted are not more than 700.
hmm
But they've had a lot of hospitalizations related to COVID, and they've also actually started a vaccine rollout. But
Oh,
at
really?
the beginning of the pandemic, a group of private individuals got together and were able to raise enough funds to build an infectious disease hospital, which I believe is functioning. Um, and it allowed it allowed some people to get access to a hospital. So the situation back in Ghana, there's COVID, there's a lot of education going on, but
Mm-hmm.
I sense that there's some hesitancy towards the vaccine. And so actually this weekend my high school will also be organizing. Last week they did, but a lot of small groups like high school alumni, they're
Mm-hmm.
organizing vaccine education webinars so that people can feel more comfortable taking the vaccine, because I believe it's a way of ending the pandemic.
Yeah, no, 100%. I think there's a lot of people who are also doing that here in the US. And even us with March for Science, we have our vaccine boosters program that we're be trying to ramp up. And that vaccine hesitancy is just a whole nother different barrier that we have to get through during the pandemic. But I guess with you doing all these things and you making all these decisions and your resume is super impressive and you have a lot of different experiences behind you. What do you think is your role when you go back home and people see you, and especially maybe young girls who are in your situation who are very ambitious and also want to be medical professionals? Do you hope that you are able to be a role model for them and get them into the field so that way they can be like your backup or your help in this fight to try and end not only malaria but also to impact the whole healthcare system in Ghana? That's a huge task.
Right. So during the pandemic, one of the things that I got the opportunity to do, there was a TV program in Ghana focused on COVID-19.
Yeah.
From about April to September or end of August, I was on TV every weekday, answering questions on COVID-19. And
hmm
I'm sure I got a lot of feedback, from social media and others interacting with me directly, that I had inspired a lot of people to want to go into medicine. I think just seeing a female physician uh,
hmm
making an impact in her local country
Yeah.
and also educating people, people were encouraged. And I even have colleagues and their children who felt that I had inspired them to pursue fields in infectious diseases and medicine in general. And so I think that I'm a role model for several people. It
Yeah.
makes it a little big of a burden to carry, meaning, look, you
Yeah.
you can't go wrong, because so many, and apart from young people, I have a lot of people who are my age mates who tell me that I'm a role model to them. I inspire them,
It's
and
pressure. There's pressure to that. It's
yeah,
being under a microscope.
it encourages me to keep pushing and keep
Yeah.
pressing on.
No, that's amazing, and you deserve all the credit and it that you've earned up to this point. And I'm really excited to just keep on following you. And to that point, if people do want to follow you and just stay in touch with your journey and see what you're doing in your work in Ghana, where can they go? I think I just added you the other day on LinkedIn. Are there any other pages that people can find you or about your story?
Yeah, I'm on LinkedIn, and
Mhm.
I'm also on Facebook. I had a personal website, but I realized it has some difficulty, so it's gone down. But it's berthaaye.com. And
Mhm.
I'm also on Facebook. I started a program, educational program, as Dr. Bertha TV. So
Mhm.
that's what's on Facebook, apart from my own professional Facebook page and my personal Facebook page. So I'm on LinkedIn, I'm on Twitter, and I'm on Facebook as well. So people can follow. I usually share things that I do on those websites.
That's awesome. Well, again, thank you so much for being here. I really, really appreciate it. And your story is amazing. And for anybody else who is watching this at home, thank you so much. And thank you to all of our donors who have made programs like this possible for March for Science. If you know anyone else who would like to share their story and has an amazing story like Dr. Ayi, please do reach out to us. My email is cody@marchforscience.com, or you can reach out to our general email at contact@marchforscience.com. And if you're watching this and you want to see more programs and more stories like Dr. Ayi's, please do consider becoming a sponsor to the show. We have a media kit, so whether you're an individual or you're a business, you can plug in and help people, just like Dr. Ayi, not only highlight what is going on here in the United States, but what's going on all across the world. So with that said, Dr. Ayi, thank you again so much for being here. It was really, really amazing to hear your story, and I hope that I see you around sometime after we all get vaccinated at least.
Right, right, right. And thank you for having me on the program. I enjoyed it.
Absolutely. All right. Thanks so much, everybody.